Welcome back to Vital Signs. We are here with our resident expert in all things heart health and treatment, our favorite cardiologist, Dr. Sonbol. And heart disease is a top health concern, especially in America, but innovations are changing the game. So I wanted to lean in and ask you, what are some of the latest advancements in heart disease prevention and treatment? Like what's coming down the pipes? What are you most excited about?
As far as, heart disease prevention, I mean, I think the biggest things that we've been working on has really been ways to target cholesterol treatment. So I'm sure, I don't know, people have heard of what's called lipo-A, which is a kind of a marker of cholesterol that people have been trying to create drugs to target reducing that because that's been shown to have an increased risk of heart disease as well. Um, Other things, a lot of medicines that we're targeting, the bigger things, obviously, things like heart failure. And, what are we doing for heart failure as far as medication wise to try to improve heart function, have people's heart function come back to normal, et cetera. There's been a lot of work on, the different receptors that modulate heart failure and medicines in that capacity, even with transplant options, right? And with, artificial hearts. I mean, there was a recent thing at Baylor where they actually put the first artificial heart in a human being. And it's kind of a way of people that have really bad heart failure, how do they, bridge them to transplant or give them a way to get their life back, as a function from a functional standpoint, because their heart just doesn't work. So I think from a prevention standpoint, there's not a lot, let's say, on the horizon for it, um, other than treatment of cholesterol, treatment of blood pressure, medications that kind of help. And sometimes it's a combination of medicines that we've had that maybe works better together than working individually alone. But I think a lot of the developments we see in cardiology in particular is in the device world and in the, how what kind of devices, what kind of surgical techniques. Like we talked about in the past, your heart is kind of like your house, right? It has architecture, plumbing, and electricity. And so what can we do from those three standpoints to improve patient outcomes, make procedures that were once complicated, like complete open heart surgeries, less invasive? How do we get people to transplant sooner? All sorts of things like that, I think, is where really the development and the future of cardiology is.
And let me ask this because a big buzzword, a big technology that's all over the media is artificial intelligence. And every day we're hearing about all of these advances in AI. Is AI playing a role in earlier detection, prevention, or treatment in the cardiology space?
I can tell you from my standpoint, no, I have not used AI to improve anything other than if I want to do a research on something or ask it a question, et cetera. I mean, there's a lot of rumors. Even Bill Gates said that, doctors are going to be replaced by artificial intelligence at some point. And I really find that hard to believe. And not because I'm a doctor or I want to say that, I'm better than artificial intelligence, but more the fact that I think there's a personal aspect to medicine that I don't think you can ever translate into artificial intelligence. It dawned on me the other day that artificial intelligence was around from Iron Man, right? The movie Iron Man. Jarvis was artificial, but he was not. It's a movie. It's not really real. And so, if anybody's ever used artificial intelligence or Chat GPT, it's not that simple. You have to ask it specific questions and really redirect it sometimes to get to where you want to go, so that it proves the answers that you're looking for. So I think from a cardiology standpoint or even a healthcare standpoint, I would really find it hard that artificial intelligence is going to replace the human aspect of medicine.
Yeah, I would tend to agree that I see it being used more in a research basis and to improve outcomes from that standpoint. But I believe it'll ultimately evolve and be used so that we can get back to being more human in medicine, which is why we went into it to begin with, most of us. So let me ask you, because one of the other things that keeps popping up online, social media, in the news is more personalized medicine. Do you see cardiology becoming more personalized as technology advances, whether on the prevention or the treatment standpoint?
The only thing I can think of as personalized medicine is what we call concierge medicine that exists nowadays. I think it does exist for cardiology and some specialties, but that's where you're kind of, almost like a private physician to a group of people, and it comes at a cost and et cetera. I'm not really sure that. I think technology is going to help improve communication between patients and their physicians. And you can see some of that now where, most offices have a patient portal. They can send a question, you can answer it back online, they can get up their lab results, etc. There's some telehealth, obviously, and everything now ever since COVID. So that was an advancement as far as being able to, especially for elderly patients that have a hard time getting into the office, or people who have elderly parents, or, that they're trying to bring in a wheelchair to the office to see you once a year. That could be a struggle. So, that kind of advancement has already been there. But I think, the way technology is going to work is it's really going to advance communication between patients and their providers. And they're going to start to develop equipment that's going to make it easier for certain things to be communicated between the provider and the patient. So, right now we have these home blood pressure monitoring, services where they give the patient a blood pressure machine, and using Wi-Fi, it transmits all their blood pressures to a database, and that gets reported back to the physician, and they can adjust medical therapy based on that. So I just think it's going to be building on what we currently have and just making it more sophisticated moving forward.
And let me ask you about wearables, because wearables continue to be more and more advanced. And in addition to the blood pressure monitoring, do you see wearables evolving or developing, or is there any talk in your circles in the cardiology world of enhanced diagnostics or maybe detection earlier from wearables and the data that they provide to maybe early detect events like heart attacks or some of the other issues that you guys see in the office and in emergency?
Sure. I mean, definitely. So, if you were to break it down again into architecture, plumbing, and electricity. So let's talk about just electricity standpoint for wearables, because that's where it's mostly used, right? So we monitor people's EKG rhythms and so forth when they have heart rhythm abnormalities or palpitations or abnormal heart rhythms. We want to track it somehow. That's the best way we can track it. So I think there's a lot of people, obviously wearing smartwatches that all have this technology, and that's been helpful, I think, in allowing people to say, hey, my watch told me I have atrial fibrillation. And then you can look at the rhythm and decide. There's these at-home service things that you can buy, like on Amazon, called this Cardia mount monitor, where you put your fingers on it and it actually gives you an EKG tracing. And I've had patients come in with this thing. They feel this stuff at home. They decide to order this monitor, and they come in the office and they're like, look, watch this. And then they show it to me, and it's real. And so I think wearables are going to become more important. Even when we send people out with Holter monitors or event monitors, um, we send them out with a wearable so that they can track their heart rhythm. I think where other advancements that I don't think people are aware of, but aren't really wearables, but they're implantables, right? So if you take, for example, heart failure, it's the number one DRG used by Medicare, and the number one reason we admit people to the hospital is heart failure exacerbation. So if anybody's ever had heart failure, and heart failure is a syndrome which is it's compromised, it's composed of shortness of breath, swelling, anything where the heart doesn't pump effectively. So it's not so much that their heart has to be weak or their heart is normal. That's what the syndrome is. And so if you were to look at, for example, recent technology that came out, a thing called the CardioMEMS device. And what this device is, it's basically a sensor. And so we can implant it in a minimally invasive procedure, like using going through your groin, kind of like we do an angiogram, but it's just a different technique. And what we do there is we put this little sensor that sits in between your heart and your lungs. And so by the time people get to the hospital with fluid overload and their volume overload and their shorter breath, those patients by that point have been accumulating that fluid for several weeks. Okay. And so they're no longer, the pills that they take at home are not effective, because if you imagine that fluid backs up not only into your lungs, but into your abdomen, into your bowel. And based on that, the pills don't get absorbed. And so one of the things we've been doing here, and I was actually the first person in Sugar Land to put one of these devices in the Fort Bend County area, is implanting this CardioMEMS device. And what this device does is you take it, you go home, and you lay on this pillow every night, and it transmits what your volume status is to a database. And then I look at that database every Monday and Friday, and I would call the patients that had it, and I would say, looks like you're retaining fluid because they're exceeding their goal that we set for them. And so I want you to take some extra water pills today, for the next several days. And so it's designed to actually reduce hospitalizations, and it's about 80% effective in reduction of hospitalizations for heart failure.
Wow,
So
that's
beyond
really,
wearables, implantables are also things that we are, really using in cardiology that has made a huge difference.
and that is huge because now you've taken something and you've caught it a lot earlier and you've maybe mitigated a major event. That's phenomenal. We are at time, but how can people reach out to you if they'd like to learn more or if they're located in the area and are looking for a cardiologist?
Yeah, they can look us up online, social media, or we're all over the place
Thank you so much for your time and your expertise, Dr. Sonbol.
anytime. Thank you.
Absolutely. And yes, unfortunately, all good things do come to an end, including this show. But the good news is we'll be back same time, same station next week. So until then, get your sleep, take care of your heart health, and we'll see you next time.